Welcome to Med-Surg Mini number 15, where we'll talk about the respiratory system and its purpose of oxygenation and gas exchange. To start off, the basics of the respiratory system include a couple of different key processes. For example, ventilation is the movement of air in, which contains oxygen, and out, which contains carbon dioxide of the lungs. Also, perfusion is the exchange of oxygen and carbon dioxide between the alveoli and the capillaries. Diffusion is the movement of a substance from high to low concentration, and this aids in the movement of both the oxygen and carbon dioxide that we see in perfusion. Oxygenation is when oxygen moves from the capillaries to less concentrated blood, and it attaches to a hemoglobin molecule. The hemoglobin molecule can hold 4 oxygen particles per cell, and the remaining dissolves in the plasma. Then lastly, respiration is the process of transporting oxygen from the air to the cells and carbon dioxide from the blood out of the body. The respiratory tract contains a lower and an upper portion. The upper portion contains the nose, the mouth, the pharynx, the nasopharynx, the oropharynx, the laryngopharynx, and the larynx. These structures contain cilia, which are tiny hair-like structures that help to move dangerous particles out of the body so that it's not breathed in through the respiratory system. It also creates mucus production, which is another mechanical barrier that prevents infection and foreign particles from entering our body. And it contains cartilage that has supportive structures to help keep all of our airways open. The purpose of the upper respiratory tract is to allow air to enter, and while air enters, it warms it, humidifies it, and filters it. The upper respiratory tract can become obstructed by inflammation related to infection and allergies. The lower respiratory tract includes the trachea, the bronchi, the bronchioles, and the alveoli. Many of these tracts also have cilia to help protect the body, and the alveoli produces something called surfactant. And this is a slippery substance that allows the lungs to expand and contract. The lower respiratory tract is a site of gas exchange, and if there isn't an obstruction, it may result in a process called a tracheostomy. When we talk about respiration or the process of breathing, we can break down a couple of different things. First off, the alveolar cells, which are the little grape-like structures at the end of the bronchioles that are inside the cell, have 2 different types of cells. Type 1 cells are squamous cells, and these are the cells that line up with the capillaries and allow gas exchange. The second type is type 2, and this is a pneumocyte, and this secretes surfactant to prevent the lungs from collapsing. Another structure that we see in the aid of breathing is our diaphragm. So in the picture of the right, you can see that when the diaphragm wants to engage inspiration, it'll pull down, sucking air into the lungs. When we exhale, that diaphragm will push up to help the air leave the lungs. Compliance is a term that we use to describe the ease of lung expansion. Compliance is enhanced by surfactant, and the more compliant lungs you have, the more air you can bring in for gas exchange. Certain disorders like COPD reduce lung compliance, which makes it harder to bring in air and enhance respiration. When we look at oxygenation, we look at a couple of things to see if our bodies are well oxygenated. The 2 measurements that we usually rely on are our SpO2, which we can get from a pulse oximetry reading. Normally, we would anticipate 92 to 100%. 91 or lower would be considered hypoxemia. Hypoxemia is when there's not enough oxygen in the blood. When there's not enough oxygen in the blood, we can't engage in adequate tissue perfusion, and this leads to organ hypoxia. Then we have our arterial blood gases, and these are drawn from an arterial line, and it measures different things like our pH. A normal pH would be 7.35 to 7.45, and this is the acid-base balance of the blood. Then we measure our partial pressure of oxygen, or our PaO2, which should be between 80 and 95 millimeters mercury. Then we have our partial pressure of carbon dioxide, which is PaCO2, normal range 35 to 45 millimeters mercury. Then we have our bicarbonate, also called HCO3, which should be between 22 and 26 milliequivalents per liter, and our percentage of oxygen saturation in arterial blood, which should be between 95 and 100%. These labs are more reliable than the pulse oximetry reading. So when we look at hypoxia in general, this is the lack of oxygenation of body tissues. It is a result of hypoxemia, which remember is low oxygen levels in the blood. And lack of oxygenation to body tissues can cause tissue death. When someone is hypoxic, typical symptoms that we see is mental status change, anxiety, restlessness, confusion, increased respirations, increased heart rate, and organ failure. To diagnose hypoxia, typically we would see a PaO2 less than 60 millimeters mercury and an SaO2 less than 90%. As I mentioned, hypoxia is caused by hypoxemia, which is low levels of oxygen in the blood, and this can occur from a disruption in oxygenation, a disruption in ventilation, and a disruption in oxygen perfusion. The main treatment for hypoxia is oxygen therapy. When we do our ABGs, or arterial blood gases, there's different ways that we can interpret it to determine if the patient is in respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. When doing these interpretations, you can think of the acronym ROME, meaning respiratory has opposites and metabolic has equal. So a normal pH, as I mentioned, is 7.35 to 7.45. PaCO2 is 35 to 45, and bicarb is between 22 and 26. So in respiratory acidosis and alkalosis, our bicarb is typically normal. In respiratory acidosis, we would have a lower pH, which indicates acidic, and a higher PaCO2. The opposite is true for respiratory alkalosis. When we look at metabolic acidosis, both the pH and the bicarb are low, and with a metabolic alkalosis, meaning equal, both the pH and bicarb are going to be high. So when we look at different types of ABG interpretations, we can start off with respiratory acidosis. The main cause of respiratory acidosis is not getting enough air into the body. Causes of this could be a reaction to anesthesia, drug overdose, COPD, pneumonia, and atelectasis. Symptoms of respiratory acidosis includes hypoventilation, hypoxia, rapid shallow respirations, vasodilation, which does include a drop in blood pressure, dyspnea, headache, hyperkalemia, dysrhythmias, drowsiness, dizziness, disorientation, and hyperreflexia. Treatment for respiratory acidosis would be to place a patient on a positive pressure device such as a CPAP or a BiPAP. We can also give bronchodilators to try and open up the airways to allow for better inhalation, and we can provide mechanical ventilation. Respiratory alkalosis, its main cause is hyperventilation, which we see a lot during panic attacks, as well as mechanical ventilation, if used at inappropriate levels, can lead to respiratory alkalosis as well. Symptoms of respiratory alkalosis includes tachypnea, tachycardia, decreased blood pressure, hypokalemia, numbness and tingling of the extremities, muscle cramps, seizures, anxiety, and irritability. Treatment for respiratory alkalosis is to provide oxygen if needed to reduce the cause. So if a patient is having a panic attack and they're hyperventilating from that, we can help doing deep breathing techniques or relaxation therapy. Then we have metabolic acidosis. The main cause of this would be diabetic ketoacidosis, diarrhea, renal failure, and shock. Symptoms of metabolic acidosis would be headache, decreased blood pressure, hyperkalemia, muscle twitching, warm flushed skin, nausea, vomiting, and diarrhea, changes in level of consciousness, and Casmuel breathing. Treatment would be insulin, sodium bicarb, sodium citrate, and dialysis if needed. Metabolic alkalosis can be caused by vomiting, GI suctioning, diuretics, and excessive sodium bicarb. Symptoms would start off as restlessness and progress to lethargy, tachycardia, hypoventilation, confusion, decreased level of consciousness, dizziness and irritability, nausea, vomiting, and diarrhea, tremors and muscle cramps, hypokalemia, and the treatment would be electrolyte replacement, saline infusions, and to stop the cause. And that wraps up our Med-Surg mini on the respiratory system.